welcome to SymCast, where we explore the intersection of technology, innovation, and patient-centric care. I'm your host, Facundo Formica, CEO of Symplast, a software provider for the medical aesthetics industry, where we elevate your patient's journey from lead to loyalty. Today, we are honored to have Dr. Tracy Pfeifer with us. She is not only a renowned plastic surgeon, she is the president-elect of the Aesthetic Society, the world's leading organization for aesthetic professionals and plastic surgeons. With an impressive multiple decades span career, she has made significant contributions to the industry through education, which I believe you are very passionate about, and also that intersection of art and science within plastic surgery. So please help me welcome Dr. Tracy Pfeifer.
Well, thank you so much. It is absolutely a pleasure to be here with you. We've known each other for a few years now. I'm very impressed with what you're doing with your Symplast product and how you're helping people in their practices elevate the patient's experience. So I'm thrilled to be here today and looking forward to our conversation.
Very good. Thank you. Well, first of all, location-wise, you are based in the Hamptons and New York City.
New York City, yeah.
And I hear that you also travel to Florida as well.
Yes, I do that, as if I don't have enough to do. Yes, I actually grew up in New Jersey, and then I did my medical school in New Jersey. Then I did 5 years of general surgery at Cornell. So that's how I got into New York. And I did plastics at NYU in Manhattan, and then I did a breast fellowship in Atlanta with renowned surgeon Dr. Hartramp, who actually invented the tram flap, which is used for breast reconstruction in patients who have had mastectomy. And then my heart's, desire was always to have a practice in Manhattan, so I, set out after my training, and now I'm on Fifth Avenue in Manhattan, and then I have an office out in the Hamptons and Quag, and about once a month I go to Florida and I see patients down there too. So it's all keeps me busy, and it's very exciting.
Oh, certainly busy. And now coming into the Aesthetic Society as president-elect. Tell me about your journey at the society.
Well, it's interesting because I've always been a person who got involved in things. So, I was always class president or editor of the yearbook, and I just was always doing things like that, student council. So when I actually was applying for my general surgery residency, I distinctly remember one of the women surgeons there, I think it was at Deaconess, she said, you're not going to have time to do all these other things when you're a surgeon. And I said, well, we'll see.
Watch me.
So I was very involved in my regional society in New York, the New York Regional Society of Plastic Surgeons. And in medicine, being a physician, education is really everything, because that's how you're increasing the quality of care. And it's also very exciting. I mean, people who go into medicine and become physicians were interested in learning things. So it's an ongoing learning process. You don't want to just, finish your training and stay stagnant. You can't do that, because things are always evolving, and you have to offer the latest technology, the latest techniques, and, the best drug therapies depending on what specialty you're in. So you have to read the journals, but you also need to go to the meetings and really interact with people and learn from the thought leaders, because there's always some people who are ahead of the curve and are really thinking outside the box. And at the meetings is where they can educate people, and the rest of us can, learn from them. And we're learning from each other all the time. So I eventually became president of the New York Regional Society. And through that, because of the people we were inviting, I met a lot of people that were involved in the Aesthetic Society. And just to take a step back, when I first went into practice, this was like year one, I met Dr. Morello and Dr. Bernard, who were in practice in White Plains, and they were past presidents of the Aesthetic Society. At that time, it was called the American Society for Aesthetic Plastic Surgeons. And yes, that's still our name, but we shortened it, so it's easier to remember. And they told me about the Aesthetic Society and how it was dedicated towards aesthetic education. And so I fell in love with it right from the beginning, because early on, people don't realize this, when aesthetic plastic surgery started, let's say in the 60s, the leaders at the time would submit papers to be presented at the main plastic surgery meeting. And because aesthetic surgery was not really accepted as mainstream, those papers were never accepted. So there was no way for the thought leaders and the surgeons who were excelling in this area to present their information to the rest of the plastic surgery community. So they decided to form their own group in order to provide aesthetic surgical education. And that was the group's founding, and it began in 1967. There were 27 people who were invited. It was invitation only. And that's how the society started, and it just grew from there. So when Doctors Bernard and Morello told me about it, I was like, oh, this is the place for me, because I knew I wanted to do aesthetics right from the beginning. And I met Dr. Grotting, who's another past president, and they're always looking for people who want to get involved and are willing to do the work. So they had decided that they were going to form a committee around this product. It was called Radar, the readily accessible digital resource, which was a very successful product, but we don't have it any longer. But anyway, I was the editor of that for several years. And then we decided to do a rebrand. Dr. Grant Stevens, who I'm sure you know, he wanted to update the website and sort of refresh the logo, and that whole project sort of fell in my lap. So that was a big initiative, and then I was invited to, apply to be member at large and then work my way up through the ranks.
Well, right there is the connection with art for the logo, the redesign, and for the education, leading editor of Radar. Yes.
Yes.
I've been in the industry for 6-7 years, involved with the society from pretty much day one. We felt the connection between Symplast and the society, and we have been very strong supporters of them, of you, and we get the same partnership back. So thank you very much.
Yeah, there's a perfect interface between technology and aesthetic plastic surgery, because we're always open to new ideas. We always want to improve things, and it's just a natural fit that we work together on these things. And it's all about patient care and delivering the results. So we have a lot in common.
Exactly. And that was one of the things that, when we were setting up, we were talking about your desire to connect with the patients. And that literally is in our mission statement. We create a suite of tools that allows the physician to forget about all the friction and the additional administrative tasks that are in commerce and in your business to deal with, so then you can actually focus on the patient. And a bunch of our tools are specifically designed for patient engagement and secure communication. So that I love that, and I want to hear more on when you say that you want to connect with the patients. It's not just, of course, the surgery, but you even said the psychology of it.
Oh, absolutely. And, it's a double-edged sword with the technology, because we can become isolated from each other as human beings. And yet human beings, we're very social people. And I think really if we isolate ourselves, then, we're not going to feel as well as we could.
Right.
So, for me as a physician, and I think most people, we go into it because we love the science and we love the learning, but we also want to help people. And it's a very rewarding experience to have a patient select you as their doctor, because all of the procedures that we do in aesthetic surgery and medicine are elective. The patient has their choice of providers. Whereas if you go into, for example, if I had stayed in general surgery, we were talking about appendectomies and things. The patient comes to the emergency room. They have appendicitis. Somebody tells them you have appendicitis. Here's your surgeon. They're going to take out your appendix. And the patient really doesn't have a choice in who their doctor is. But in our specialty, they do. So the patient has to feel comfortable with you, and they have to trust you. And so you have to work to earn that trust. And anything that technology can do to streamline the bureaucratic, administrative side of the practice, so that the surgeon and the staff can focus on the patient that's right in front of them, is something that benefits everybody. And I think the patients also have confidence in a practice that's involved in using technology, because if you look at young people, they're all using it. So if you're
Right.
not using it, you're kind of, behind the eight ball, and maybe they don't trust you as much because, why don't you have the latest and greatest, systems in your office? It's a very nice marriage between what you guys offer on the technology side and what we're doing on the patient care side.
Yeah, thank you. And yeah, it's funny you mentioned that a patient needs to or you need to establish that trust relationship with the patient. And being accessible, it's certainly one of those ways. You and your staff being accessible. So that's why one of our biggest, or the biggest use of our platform is secure messaging, which actually enables that in a HIPAA compliant environment, allows the patients to connect with you or your staff when they are in need. And as early as they're a lead to you, that they're prospective, they're evaluating, they're comparing you with other practices, certainly they will put pretty big stake on can I reach them?
Absolutely.
If now when I'm just shopping around, I have difficulties that I have to wait until 9 a.m. to call them or something like that, I can only imagine what's going to happen once they have my business. So it is very interesting that you mentioned that aspect of actually connecting and reducing the administrative burden, so then you can spend more quality time with the patient. It's not only more time, but more quality time with them.
Oh, 100. I couldn't agree with you more. I mean, if you talk to patients, the first thing they'll say to you is, "Oh, I had a hard time reaching the office. They never got back to me." And that's one of the great things about electronic medical records, which, there definitely are pros and cons to it. But from the patient standpoint, it's definitely a pro, because they no longer have to call the office and say, "Let me have my records." They just can access their records online. So at the same time, sometimes when people will actually see, not through your system, but through like hospital systems, for example, they'll see their results before the doctors even had a chance to, call them and let them know about the results. So on that side, that's not good, and it can be improved. But in general, it's the patient's information. They should have access to it. But then, as you said, it's that personal connection and being able to reach somebody in the office. I mean, they just will rave about the fact that, somebody called me back right away. I can always reach so and so. She's always available. The doctor always calls me back if I leave a message. Those things are important. And everybody's a human being, so we want the same thing for our patients that we would want for ourselves if we were a patient.
And to that, everybody's a human being, but it's an individual. So it's extremely personalized care. So you need to literally treat every patient as an individual that has individual goals, and something that works for one, it will not work for everybody. So bottom line is personalized care. And you mentioned that normally, especially hospital-based EMRs, they might allow patients to see information before they even see it, or that personalization is a lot more difficult. That's why really Symplast came about. Dr. Shashi Kasuma, a plastic surgeon, practicing plastic surgeon in Western Florida, because one of the things that why we came to be is because all the workflows were customized for insurance billing, and where really the patient is just a passenger instead of a co-pilot of their own health.
Oh, that's a great way to say it.
He recognized that difference between providing care and access to information to aesthetic patients that is very different than the regular care that is being done at hospitals, and how they allow the patient to access information and whatnot. So that's how Symplast came about. We recognize that the workflows from the EMR side to the financial side to the communication side, even what type of data they want to see and collect, instead of just only text-based, there's a lot of multimedia. And that's why we created that completely different ecosystem that serves the niche of medical aesthetics.
Some of the first systems that came out for EMR were really focused on getting the support, for the when you make your office note to make sure that it would support the coding that you were going to use, which was then going to be submitted to the insurance company for reimbursement. And that's a very different, they're satisfying different needs through those systems compared to what we in our aesthetic practices need. We need the multimedia. We need the templates. We need the patient communication. Those are priorities for us. And so I think, Symplast really satisfies what we need. And it was developed by a practicing plastic surgeon.
Exactly. and we focus on the patient being the client, right? That profile is different when really in traditional medicine or insurance-based medicine, the insurance is the client and the patient is the vehicle for them to actually do all the billing and the servicing. How about if we switch gears into the business of aesthetic? Is that okay?
Yeah, sure. Absolutely.
Because I think that's one of the things that also personally I have a technology background and I've been in many different type of businesses, but one of the things that I noticed coming in is that running the business of aesthetic plastic surgeon, it's extremely different to running a business of insurance-based specialist. Very different. Like even from a cash flow point of view, you tend to have the cash flow up front and then you deliver the service in the back end. Mm-hmm. When in insurance, it's exactly the opposite. You have the delivery of the service first and then the cash flow later, which if I be an accountant, I would speak of accounts receivable and liabilities. And what I noticed is that a lot of practices were not too comfortable when it came to the financial aspect of running the business. Is that something that you see in practice when not only on yourself, but when you talk to other physicians, which tend to be the business owners, that they need a lot more advice or training on that area?
Oh, 100%. We don't learn anything about business when we're in medical school. And if you don't have somebody in your life or parents or, somebody who can advise you on these things, you really don't know what you're doing from a business standpoint. So the Aesthetic Society and other people that we work with, such as Symplast, are very helpful with us in this respect. So the Aesthetic Society has stood up a business side of your practice where, we have courses that are targeted towards these things that you just mentioned, training patient coordinators also, but we can always improve on what we're delivering in terms of education for how to run a private practice. And you do see in the field that there are venture capital companies that are actually buying, practices because they know how to run businesses. But at the same time, they may become more profitable, but we do see that they become depersonalized. So that's really a negative. I always say I will never, sell my practice to one of these companies because I don't want to ever lose that personal, connection or have somebody telling me how to treat my patients. And that's what you see in the non-aesthetic side of medicine. You see that the insurance companies have taken over. Many of the private practices, whatever it is, internal medicine, pediatrics, cardiology, dermatology, they're bought by the hospitals because when the hospitals submit a bill for to the insurance company, the hospital has negotiated a rate that is higher for the same service than what the private practice physician would get. So in order to stay competitive, all of these doctors have had to sell their practices to the hospital. And the hospitals are for-profit entities. And this is not why myself and I think most other people went into medicine. Yes, you want to make a living, but the shareholders and the CEO making, millions and millions of dollars on the backs of the doctors and the patients. And we did have that, CEO, unfortunately, was, gunned down. I don't know what was all behind that, but there's a lot of frustration with the insurance industry. And of course, no violence is ever justified. From my standpoint, when I look at what we do, because we do take a payment up front, I think it's a very clean system. this is what you're having, this is your procedure, this is the deliverable, this is what we charge. You can accept it or not accept it. You pay it or you don't pay it. And to me, it's very clean. You're not arguing with insurance companies about stuff. You're not sure, what's the patient going to be responsible for. You know upfront as the patient what your cost is going to be. So I like that because I think it's a very, very clean relationship, and it appeals to me on that level. And I've had many discussions with people who are like in rheumatology and stuff, and they kind of look at you and say, oh, well, people are paying you. And I'm like, well, people are paying you too. And ours is a very transparent transaction. Whereas with the insurance companies that the physicians have to participate in, it's a very opaque process. So I'm very proud of what we do. Now, there are people who take advantage of, patients in terms of financial things. There are people who do that. There are people who don't deliver the results that the patient is expecting, and then instead of, correcting it, maybe they try to avoid correcting that. So we do have that problem on our end. But as far as the business goes, our consultants, the people that we partner with are so important because you all come from a business background. And so you're a tremendous asset to all of us, really.
So much to unpack, and I love the alignment that I'm seeing in there. What I've noticed is private equity buying out the non-surgical aspect of it. And it is also very artistic and personalized, but I think that it creates that space. When you're so focused on the business side, it creates that vacuum, that space that is in between the patient and the provider, and it becomes depersonalized. Which, like you mentioned, this is elective medicine. You don't have to do this. You want to do this. And as a patient, especially if it is surgical, you're putting your life at stake at the hands of the doctor for something that you didn't really need to do, but you wanted to do. That's why, going back to the trust that you mentioned much earlier, it's fantastic to see the full circle, how it is from the medical point of view, but also from the price transparency point of view, from reducing any friction between the patient and the staff, not just the doctor, but the whole practice, from the financial friction to communication friction to just doing business regularly. So focusing on the patient, it has been our guiding light. That's why we mentioned that it's very patient-centric design software, because we consider the patients our clients through practices and doctors like yourself, in order to deliver that concierge level of service that you can deliver to them.
Yeah, I love that. It's all about the patient. And, at the Aesthetic Society, our brand pillars are beauty, education, artistry, and expertise. But underlying all of that is safety. And so safety has to be the paramount thing, not driving the bottom line. This is, the challenge that we face. And for the patients, can be very confusing. I know you're from Florida, and, Southern Florida has a lot of places where, for example, the patient will come in, and it's not just in Florida, it could be anywhere. The patient will come in and they will meet with a patient coordinator type person, sign up for the surgery. They have not met the physician. They have not understood what procedure is going to be, tailored to their needs. They're paying up front, and then they're meeting the surgeon the morning of surgery. And this is where the Aesthetic Society and those of us who are, practicing ethical medicine have a real problem, because in that situation, the patient is really just a commodity. I mean, you are really just a revolving door, and you have to process a lot of patients because the cost is lower. So it is not personalized care, and the patient's safety, I do not think, is the priority there. And what we want to do is we want to educate patients that they need to look for doctors who really are putting them, the patient, first, and then has the skill set and the expertise and the ethical behavior that's going to, treat them the way they need to be treated. They're going to have the result that they want, and they're going to have the experience that they want in a safe
In
way.
a safe way. Right.
Yeah,
Oh, fantastic.
it's so critically important, and this is really, it's been a challenge because with social media, people posting things, there's a lot of information out there. And we just had an interesting talk the other day, actually, about how when people get something in their mind, like the first thing that they hear, a lot of times, even if it's not true, it's hard to dispel that belief. So the patients sometimes are getting information from sources that are not really reliable or accurate, and then we're trying to sort of undo that belief. And one thing that we do want to encourage people to look for is at least look for a plastic surgeon that's board certified by the American Board of Plastic Surgery. Not just board certified, because you could be board certified in emergency medicine and in some states doing a tummy tuck. That's totally different from somebody who's board certified by the American Board of Plastic Surgery.
Yeah, that's a very good point, and I think that the society has continued to deepen their focus on safety and education. So tell me, what are you looking ahead?
We have a lot of exciting. Yes, we have a lot of exciting initiatives that were started by Dr. Movasagi. He's our current president. And one big gap that we saw was in what we call the allied professionals. So there are physician's assistants, nurse practitioners who are doing, injections. And so Botox and fillers. And there really is no formal training program for them. A lot of the companies that offer the products have their own, training seminars. They may work with a surgeon who trains them, but there's no formal professional group for them to be part of for organized education, and also, like a support system if you, have a question or you want to have some advice. So we've stood up a category of membership in the Aesthetic Society called Allied Pro. And we're starting off with a big push to invite the injectors to come in, but we're also going to have programming for practice managers, patient coordinators, surgical techs. So we're really excited about this, really a passion of Dr. Movasagi's, and I think it's perfect because not only is it helping these allied professionals have a home base, a place that they can be proud of, part of an organization that they can be proud of, but it also helps the independent practitioners practice. Because instead of having to train this person and that person, you have a place where your staff can go for training. And I think it's only going to help our members' practices. So we're really, really excited about that. And then on an international level, Dr. Movasagi and Dr. Mindy Hawes before him really started reaching out to plastic surgery societies internationally. So there are some countries that have small groups of plastic surgeons, but again, they don't have the infrastructure to really provide the education to their members in all cases. So we have these memo of understandings with now, I think it's up to 36 countries worldwide. We just decided that we will also invite not only the practicing plastic surgeons, but their fellows and residents to be members of our society. So they will have free access for the residents and fellows to our educational content. And then, the practicing surgeons pay a small fee to have access to it. But this is the way that we're trying to share our expertise and knowledge, worldwide. And the Aesthetic Society is really the premier society for aesthetic education. We're widely acknowledged for that. So we're very excited about our international partners and really reaching out to the young surgeons so that they can have a place that they can call home, whether they're a U.S. citizen or an international citizen.
I like that too, the young surgeons aspect of it, starting a residency, because like you said, they don't get trained on many other areas that are critical for their business, and we already established that private practice is likely the way to go in order to deliver that level of patient care and connection with the patient and being patient-centric. It will continue to be a trend that we see. And I've noticed an uptick on residents opening their own private practice right away, which I think it was a little bit of a shift of first joining another plastic surgeon and then either splitting up or buying out the practice from the retiring plastic surgeon. I see a lot of younger doctors now jumping straight into opening their own practice. And to your point, the society doesn't only focus on spreading the newer techniques and technologies and safety around the surgical side, but also on the non-surgical side. And you just mentioned that even for practice managers, the business side of running the practice. So that's fantastic.
Yeah, absolutely. Yeah, I mean, education is, near and dear to our heart. And when we had COVID, everything kind of changed, as we all know. So we didn't have a meeting one year. And our big event is always our annual meeting. But then we started doing virtual things, and my big focus is, year-round education. What are we delivering to people year-round? So we started having some monthly webinars with our international partners. We're going to have a masterclass series. It's going to be the first Saturday of every month. Dr. Movasagi is going to be our keynote speaker talking about brow lifting. But it's all also meant to be very interactive, because that's what the young people want. They want to have quick tidbits, and they want to have interaction with people where they can ask questions. So it's going to be a very interactive session where people can submit their cases or just ask questions, and his topic is going to be on brow lifting. So we're excited about that. And then we're going to have Dr. Pat Pasmino talk about BBL. And then we're going to have, Holly and Simeon Wall. They're going to be doing breast right before our annual meeting, which is going to be in Austin this year. So they'll be the speakers in March. So we're really trying to stand up year-round education for all the different groups.
Very nice, very nice. So when are you taking your new position?
It'll be the end of March at the annual meeting in Austin. We're very excited about it. We've shortened the name. We used to call it the Aesthetic Meeting, and we're calling it the Meet.
Yes.
So it has a nice ring to it, and we're very happy to be working with a wonderful graphic designer who is very creative that I worked with on the rebrand project, and he's really doing some beautiful artwork to really express, that side of what we do and attract people to the meeting and also to the society.
I have seen some things in social media already. It's very, very artistic. Very beautiful.
Yes, he's very talented.
Well, thank you so much for coming.
Thank you. It's been a pleasure.
It has been a pleasure.